Daiane.
Muy buenos días a
Good
todos.
morning to all of
ladies
you.
and gentlemen, and welcome to today's webinar. Bon dia, señoras y señores. Bonjour, madame, messieurs. Primero que nada,
First of all,
saludarles, contarles que este evento
aside from greeting you, I'd like to
tendrá
tell you that this
traducción
event will be
simultánea en
translated
español e
into
inglés.
English and
Pueden
Spanish.
seleccionar el
You
idioma
may
de
select
preferencia
the
en el
language of
icono
your
del
choice
mundo que
at
aparece
the
abajo
world
de su
icon at the
pantalla.
bottom of your screen.
También les recordamos de poder
We remind you
silenciar su
also
micrófono.
that you
Gracias.
keep your microphones
Ahora sí,
muted at all times.
desde la Organización Panamericana de la
On the
Salud,
Pan American
damos
Health
la
Organization, we
bienvenida
wanted to
al
welcome
webinario
you to this
promoviendo la salud
webinar
mental
promoting
y previniendo
mental
los
health
trastornos
and
de salud
preventing
mental,
mental
promoting
health
mental health
conditions.
and preventing mental health conditions. Este webinario se enmarca
This
en la
webinar
serie de bases
is
para el
within
cambio en la
the
salud mental
series of
de las
changes in
Américas.
mental health in the
Mi
Americas.
nombre es Matías
My name is
soy
Matías
asesor regional de
Sinahuaza.
salud
I'm a
mental,
general advisor of
consultancia
mental
para la
health
OPS,
for
OMS, y hoy
PAHO,
tendré el gusto de
WHO, and
acompañarlos
I
en la
will
moderación
have
del
the
evento.
pleasure of chairing this
La
event
grabación de
today.
este webinario estará disponible en el canal de YouTube
I'm
de la
sorry, his
organización
sound is coming
y
and
además
going.
estará
He's
disponible en la
interrupting.
página web
And
de la
it will
emisora.
be
En el chat
available on
les
the
estamos
webpage.
colocando el
In the
vínculo
chat,
de
we're
YouTube y el
placing
vínculo de
the
la
link for
página
the
de la
YouTube
serie
and
de
the
webinarios
webpage of the
y este
webinar
evento en
series,
particular.
and for this particular
A
event.
continuación les presentamos la
I'd now
agenda
like to
para hoy.
introduce or show you
Nos
actually today's
pudieras
agenda.
ayudar, Natalia,
Would you help us
a
with
montar
that,
la
Natalia?
agenda y les invitamos a acompañarnos
And we
durante la
invite you
siguiente
to
una hora y
join
media.
us
Les
for the next hour
realizaremos
and a
las
half.
presentaciones y posteriormente
We
daremos
will
un
make some
tiempo
presentations,
para
and at the end, we'll
preguntas y
have some time
respuestas
for
que
questions
esperemos
and answers,
facilite
which
la
hopefully
profundización
will
en
make it
aspectos
easier for us to
de las presentaciones que les
get
parezca
into
a
further
ustedes importantes y
details
si
of
fuera
aspects that may
necesario
be of
que
importance to
ayuden
you, and
a
if
aclarar.
necessary, to
Utilizaremos
help
el
clarify
chat
issues.
para
We
comentarios,
will use the
inclusión
chat for
de
comments
preguntas y
and for
respuestas,
questions and
Q&A,
answers,
para que puedan realizarlas durante
so
el
that you
webinario.
can do them
Por favor,
while
escriban las
the
preguntas en
presentations
esta
are being
sección
made. Please
para
write your
facilitarnos
questions in
el
that section
acceso
to make it
y
easier
evitar
for us to
confusiones
access
con los
them and avoid
comentarios. Aquella
confusions.
pregunta que no podamos responder
Questions
para ser
which
sin duda
cannot be
de
answered
sumo
during the session
importante para
will
el
be an
avance
important input
posterior.
for future
Ahora
events.
sí, quisiera darle la palabra
Now I'd
al
like to give
doctor
the
Renato
floor to
Oliveira
Dr.
Sousa,
Renato
quien
Oliveira
es el jefe de la unidad de
Sosa,
salud mental
head of the
de
mental health
subinstancias
and
de la OPS,
substance
de la oficina en
abuse
Washington.
chief in the
Doctor
Pan American Health
Oliveira,
Organization's office
Muchísimas
headquarters.
gracias,
Thank
Matías.
you,
Buenos días a
Matthias.
todos y a todas.
And good morning to all of you.
Bienvenidos al quinto webinario de
Welcome
la serie
to the
Bases para el
fifth
cambio en la
webinar
salud
of the
mental de las
series Basis for
Américas.
Changes in
Me
Mental Health in the
complace
Americas.
darles la bienvenida a
And it is
este
a pleasure for
importante
me to
evento
welcome you to this
intitulado
very important event
Promoviendo y
entitled
Preveniendo
Promoting
en
and
Salud Mental.
Preventing
Como jefe de la unidad de salud mental y uso de
problems with mental
sustancias de
health.
la Organización
As
Panamericana de
the
la
head
Salud,
of the
quiero
mental health and
enfatizar
substance
la
abuse
crucial
in
importancia
PAHO,
del
I
tema
want to
que hoy
emphasize the
nos convoca.
importance of the subject that
En las
we're dealing with
Américas,
today.
los
In the
problemas de salud
Americas,
mental
mental health
representan una
problems
carga
are
significativa.
a significant burden,
Constituyen casi un
and they're
tercio
almost
de
a
todos los años
third
vividos
of
con
all the
discapacidad.
years
El
lived with
suicidio,
disability.
con 100.000
Suicide,
muertes per año, es
the
una de las
number
causas
of
más
deaths a year is
frecuentes
one of
de
the most frequent
mortalidad
causes of
entre jóvenes en la
mortality
región.
amongst the youth in the
Estos
region.
datos
This
subrayan la
data
urgente necesidad
show
de
the
acción en
urgent
nuestra
need for
región.
action in
La
the region.
promoción y prevención
Promotion and
efectivas,
effective
importantes
promotion and
pilares de
preventive
la salud
are
pública,
important pillars
son
of public health
fundamentales
and are
para
fundamental
mejorar el bienestar
to
mental,
improve
la
the mental
resiliencia,
welfare and
prevenir
resilience,
la aparición y la carga de
preventing the
las condiciones de salud
appearance and
mental
burden
y
of mental health
reducir la
conditions
necesidad
and
de
reduce
atención en
the
salud
need
mental.
for mental health
La
care.
Comisión de Alto Nivel sobre
The
Salud
High
Mental
Level
y
Commission on Mental
COVID-19
Health
de la
and
OPS
COVID-19
ha
in PAHO
subrayado la
has
urgencia de
highlighted the
fortalecer las
urgency of
estrategias de prevención y
strengthening
promoción
prevention
en el
and
contexto
promotion
de la
strategies within
pandemia
the
y más
context
allá.
of the pandemic
La
and
Comisión
beyond.
recomendó
The Commission
aumentar la
recommended that
inversión
we
en programas de
increase
promoción y
investment
prevención
in
de la salud
prevention
mental,
and promotion programs for
integrar la
mental
salud
health,
mental en
integrating
todos los
mental health
sectores,
into all
incluyendo
sectors, including
educación, trabajo y
education,
protección social,
work, and social
y
protection,
empoderar las comunidades para
empowering
acometer
communities
iniciativas de
to
promoción de la
carry
salud
out
mental.
mental health promotion activities.
Nuestra estrategia
Our
regional para
strategy
mejorar la
in
salud
the
mental
region to
y
improve
la
mental
prevención
health
del suicidio
and
se alinea
suicide
con estas
prevention is aligned with
recomendaciones,
these recommendations,
enfatizando la importancia de
emphasizing the
desarrollar y
importance of
implementar
developing and
programas de
implementing
promoción y prevención
promotion and
dentro de los
prevention
sistemas de
programs
servicios de
within
salud.
the
Estas
health
iniciativas
services,
requieren una acción
initiatives which would require
multisectorial
of
coordinada.
multisectoral action
En
a
este
well-coordinated
webinar vamos a
multisectorial
tener la
action.
posibilidad de
In
escuchar
this webinar, we'll have the
diferentes
opportunity of hearing
experiencias en
different
nuestra
experiences
región,
in our region,
experiencias que pueden
experiences which
ayudarnos a
may help
actuar
us
antes que los
act
problemas
before
aparezcan.
the problem arises.
Contamos con expertos en
We
agricultura de
count on
campo y
experts in the
personas con
field,
experiencias de
persons with
vida que
lived
compartirán sus
experience
conocimientos y
who will share their
prácticas.
knowledge and practices.
Espero que este intercambio
I
nos
hope this
inspire y nos
exchange will
proporcione
inspire us
nuevas
and give
herramientas
us
para
new
transformar la salud
tools to
mental en las
transform
Américas.
mental health in the
Agradezco
Americas. I
sinceramente
want to
su
honestly thank you
participación,
all for your
así como el
participation,
valioso
as
apoyo
well
de
as for the
nuestras
valuable
oficinas de los
contribution of
países,
our
los
country
ministerios de
offices,
salud,
the health
colegas de
ministries,
otras organizaciones
colleagues
y
from other
principalmente
organizations,
a
and
nuestros
particularly
panelistas.
our panelists.
Juntos podemos construir un futuro
Together,
donde
we
la
can
salud
build
mental
a
sea una
future where
prioridad
mental
para
health is
todos,
a priority to all,
implementando efectivamente las
implementing
estrategias de promoción y prevención
promotion
que
and
nuestra
prevention
región
strategies
necesita.
effectively
Les
as
deseo
required
un
in the
webinario
region. I wish you
productivo
a
y
successful and
enriquecedor.
productive
Muchas gracias
webinar,
nuevamente.
and thank you again for
Le
joining
paso
us
la palabra
today.
de nuevo.
And I
Gracias. Muchas
return the
gracias.
floor to you, Matthias.
Muchas gracias,
Thank
doctor
you,
Oliveira,
Dr.
por
Oliveira,
las palabras de
for
introducción
your
que nos permiten
introductory
abrir el tema
remarks,
de hoy y
which
motivarnos
helps us
también
begin
para
our topic
profundizar.
today.
Ahora quisiera presentar
I'd now
a
like to
nuestra primera
introduce our
panelista.
first speaker.
Nos acompañan hoy día la
We
señora
have
Lady Ospina.
Mrs.
Ella es
Lady
mujer y
Ospina
madre de
today. She's
dos
a
de
mother
mujeres
and
de
woman and the mother
Valparaíso,
of
familia que se
two
atiende en el Centro de Salud Familiar
um,
Mata Sur de
young
Santiago de
girl
Chile.
who's being treated
Nos
in the
acompaña
Matasur
también
Center in
Verónica
Santiago
Beris
de Chile,
Rojas,
and
coordinadora
Veronica
nacional del
Beris Rojas,
componente
the
de salud
national coordinator of
de
the
Chile
health
Crece
component in
Contigo
Chile,
y de
is
la
with us as well.
subsecretaría de Redes
Grow with us,
Asistenciales
Crece
del Ministerio
Contigo,
de Salud de Chile.
from the health
El
ministry in
título de la
Chile. The
presentación de
title
hoy
of the
es La
presentation
vivencia y el
today is
testimonio de
the experience
participación
and
en la
testimony
promoción del
of
desarrollo
participation
integral
in
del
the
niño y la
comprehensive
niña.
development
Por favor,
participation
señora
of the child.
Ospina,
Mrs.
señora Beris,
Ospina, Mrs. Beris,
micrófono de ustedes.
the floor is yours.
Buenos días.
Good morning.
Estamos transmitiendo desde Santiago de
And we're
Chile y
from
vamos a
Santiago.
compartir la
We're going to
presentación o la
share
comparten
our
ustedes.
presentation, or would you like to do that?
La vamos a compartir.
Como ustedes
Or
prefieran.
we share it as you wish.
Y si nos pueden,
Well,
vamos a
if
compartir
you
nosotros.
can, we'll share it. If
Puede
we,
ser más fácil.
yes, it's probably easier if you do.
Ahí se está cargando.
It's loading right now.
Ya se puede ver.
We can see
Ya se
your
puede ver. Ya.
we can see
Sí,
your
en pantalla
presentation
completa, ¿cierto?
in complete screen. Can you see it?
Ahora sí.
Okay, now we're
No
seeing.
está en presentación todavía.
It's
No.
not in presentation mode yet.
Está solamente.
There
Ahora
you go.
sí. Ahora
Now
sí.
you have it in presentation mode.
Yes. Bueno, vamos a. Mi compañera es Lady.
My colleague,
Voy a
my friend here
presentarles
is Lady.
primero
I'm going
el
to make a
contexto del Chile
presentation
Crece
first, telling you
Contigo,
the
que es una
context of
política
Chile, of
pública
Crece
que
Contigo,
lleva
Grow With
18 años
You.
de implementación en
It's
el
been
país y fue la
implemented for over
primera
18 years in the country
política
and was the
pública que
first public
releva la
policy
importancia de
highlighting
focalizar
the
las
importance
acciones
of focusing
promocionales y preventivas
promotional and prevention
en niños y
actions
niñas
on
para su
children
bienestar y el de la sociedad
for
en su
their
conjunto,
welfare
tomando en
in society as a
consideración todo
whole,
lo que la
taking into
evidencia decía
consideration all the
respecto a la situación en la
experiences
cual se encontraban los
regarding the
niños y niñas en
situations in
nuestro
which the
país.
children were
Por lo
in
tanto, el
our country.
objetivo de
So
esta
the
política
objective of
pública
this public
era
policy
contribuir al desarrollo
was to
integral
contribute
y o
to the
psicosocial de
comprehensive
los niños y las niñas
psychosocial
que se
development
atendían
of
en el
children
sistema público de salud.
receiving care in the public health
Y actualmente
services.
llegamos hasta los
And
9 años,
currently,
en
we
principio
go
era hasta
as
los
far as
5 y
the
pudimos
year
ampliar
9.
hacia los
Originally,
5 o 6
it was
años hasta los
5, and
9
now we've extended it to 9 years
Desde el
old.
2009 a la fecha,
Since
que fue el año en el cual
2009 to
Chile
date, which
Crece
was the
queda
year in which
instalado con una ley, con
Crece
esta
Continuo
misma
was
ley de
established as a
prevención,
law,
se han incorporado también varios lineamientos
we've
y
added
gestiones
several action
complementarias
guidelines
con
to
leyes que también
complement,
han ido
together with Lady,
complementando
who
y
have been
reforzando las acciones que ya se
complementing and
venían
reinforcing
instalando en la red
actions that
asistencial
have
de
been
nuestro
set
país,
up
como la
in
ley de
the
protección,
healthcare services in our country,
fortalecimiento
like
de
the
la infancia
protection,
materna, hay
strengthening of
una ley reciente
breastfeeding.
respecto a
There's
la
a
abordaje
recent law
integral
regarding
también que
comprehensive
viven
approach of children
gestacional
living
o perinatal, hay
in
el
perinatal
acompañamiento
and
también a las
pregnancy
familias, los niños y
situations,
las
the
niñas que se
support to
encuentran
children and
hospitalizados
families
en
who are
neonatología
hospitalized
o en
in
pediatría.
neonatology or in pediatrics.
También hay nuevas leyes
There's a
respecto al
new
abordaje
law
también de
also
los
for
niños y las
the
niñas en situación
approach
de
of
vulneración
children
de
in
derechos. Y la más
violation of
importante,
their
que fue
rights
publicada el
situation. And the most important, which was published in
2022, es la Ley sobre
2022,
Garantías y
was a law
Protección
on
Integral
guarantees
de
and
los Derechos de la
comprehensive
Niñez y
protection of the rights
Adolescencia.
of
Y esto
children
hace que
and
el Chile
adolescents.
Crece cambie
And
su
in
marco
Chile Crece
de
changed
protección
their
social hacia
framework
la
of social
garantía de
protection
derechos.
to ensure the rights of the children. In Chile Grows, Crece, or Grow Chile, they have several psychosocial programs. There's support to the newborn, support to mental health that follows the children and the families from pregnancy to the age 9. I'm sending you a link if you need to have more information about it. Currently, in the services, we have registered 80% of the country's population in the public services. And in 2024, that was a total of 15 million people registered in the public health service. The population under control last year in our establishment from 0 to 5 was 569,820 children in the country. From 0 to 5, where most are percentage of boys mainly. The newborn last year were 112,308, which has also had a downgrading, a down trend. And of the births in the region, of the total number in the public service, there are 64.5% of the children born in Chile, with coverage of PAHO delivery, which is a series of tools that is given to about 95% of the children. So Chile Crece or Chile Grows is implemented throughout the country in the children found in the urban region. We reach all corners of the country. There is a harmonization, which is very timely in all sectors, to deliver services to the children, and some specific for children that have certain conditions that may place their development at risk. The current services are added to a technical standard for care in APS. There's a catalog of services which is updated once a year, and we have studies and evaluations that have helped us improve the strategies and the tools. Chile Crece has a digital platform that also helps us follow up the development and the accompanying or the support given to the family. And No One's Perfect, which is implemented in the country, is currently a model that uses the experience of the families living in the country, and it's a cognitive learning with closed groups of 6 sessions with 6 to 12 families participating, lasting about 2 hours. And what it seeks to do is to help them improve implementing reading safely, caring for their children. There's an experience with shared activities, games, with knowledge of the family so that they participate in the group, making it easier for them to learn and have discussion groups with practical activities, resolving day-to-day activities that they may face when taking care of their children. And the children must be from 0 to 5. Now, for this, we offer a cascading training. There's training throughout the country. There's training in the health services, and there are facilitators in the health establishments so that they can offer care to these families. And now I'd like to leave you with the lady's testimony. Good morning. My name is Lady Cristina. I was born in Colombia, and I'm in Chile since 2019, before the pandemic. I live with my husband and my baby, who's 20 months old. I come to tell you my experience since my prenatal control began, where they cared for me, giving me wonderful care. I have no words to explain what I received. I had a chance to go to the workshop because I really felt that had I not come to the workshop, I might not have been able to take care of my child. I think I do things better than what I did with my older daughter, who's now 22. I had her in Colombia. The difference is that when I had my daughter, things were not the same.
El parto fue muy diferente,
The
la atención en
labor
Colombia
was
fue
different. The
también
care I
muy
received in
difícil.
Colombia was
Y
very
aquí
difficult.
acá he tenido
And
más
here, I've
oportunidades,
had more
me
chances
me
to
apoyaron desde un
learn. I
principio.
received support from the very beginning.
Me apoyaron desde un principio,
I received support from the very beginning, from
estaba embarazada.
when my pregnancy began.
Vine al taller
I came to the
porque
workshop
realmente vine al taller porque realmente
because
lo necesitaba.
I
Estaba en una
honestly felt I
depresión,
needed it. I was very
me
depressed.
encontré
I was
donde dejaba llorar a mi bebé.
in a situation where I let my daughter cry.
Cerraba la puerta, la
I
dejaba
just closed the
llorar,
door and let her cry. I didn't care.
Llegué al taller donde
I came to the workshop where
encontré con
I
Nicolás, de acá de
found
Matasur.
Nicolás in
Él
Matasur. And
estábamos varias familias,
there were
pudimos
several
mirar
families there, and we were able
los
to
vacíos, las necesidades que
see
teníamos
the
cada
gaps,
uno
the
de los
needs that
padres,
we
y
had
fue un
as
apoyo
parents.
donde
And
me
we
siento que
received
estoy
the
haciendo
support, and I feel that
mejor las
now
cosas que cuando
I'm doing
tenía
things
mi
better
hija
than when I
a
had
la
my other
cargo.
daughter, the older girl.
Yo
I
cuando tuve mi hija grande
when I had
en
my
Colombia,
eldest
a mí
in
me
Colombia,
decía la médica, no,
the
vaya,
doctor would tell me,
apárese,
no, just
creía que
go,
yo
get
podía
up.
pararme
They
sola,
told me
ya
I could get up on my own.
a mi hija, acá no,
When I
acá me
was about to have
acompañaron
my
desde el
daughter, no,
principio, me
here they
atendían,
followed me from the very
no se
beginning. They
mueva, no
cared for me. They
camine,
told me not
no
to
se
move,
vaya,
not to
todo
walk, not to leave.
en el hospital de aquí
In the hospital here
el hospital. En el San Borja, todos
in
me
San Borja,
apoyaron, todos
everyone
los
supported me.
médicos,
Everyone
desde
from
el
the
principio.
beginning, all the doctors,
Me dieron todos los
they
implementos
gave me all the tools I
como
needed,
el corral,
like the
todo.
playpen and everything.
Es que Soledad me desconcentró.
I'm
Me
sorry.
disculpa.
I apologize.
Entonces, esto ha sido una
And
experiencia muy
this has
bonita
been
y
a
agradezco
wonderful
a
experience, and I
Nicolás
really want to thank
y
Nicolas, and I want to
todos los
thank
del Hospital de
all
Matasur
the people from
por
Matasur
apoyarme
Hospital
tanto.
for giving me all that support.
Sí, sí, cuando yo vine al taller,
When I came to the workshop,
estoy en un momento que
I was
yo solo me devuelvo
in a
porque
situation
cuando
where,
yo tuve a mi Antonella,
because when
yo
I
la
had
tuve en Colombia, en el
Antonella, I
Hospital
had
San
her
Juan
in
de
Colombia in the
Dios,
San Juan de Dios
y
hospital
toda la
there.
experiencia fue muy
And
difícil.
the experience there was
Allá
very
no
difficult.
le prestan atención a uno como
No
me la
one pays
prestaron a
attention
ti.
to us there as they
Para
did
tener
here for
yo a
me
mi
when I had
bebé,
my baby
me
here in
decía
Chile.
que, o sea, me levantara al baño,
I was told to get up to the
yo podía
bathroom, that
caminar.
I could walk
En
without a
cambio aquí,
problem, while
hasta
here,
la doctora, la matrona que
even
recibió a
the
mi bebé,
doctor and
nos dio
the
un abrazo a mí, a mi esposo, nos dijo
midwife helped
que
me,
nos apoyábamos.
and
Siempre
they
que
told us,
iba
they gave us all the
al hospital,
support.
siempre
Whenever I went
lloraba,
to the hospital, I was always
porque sentía
crying
que les
because I
debía mucho
felt that
agradecimiento,
I was so
porque sentí
grateful
que este
to them,
país
because
me
I felt
apoyó
that in this
mucho.
country I really received a
Fui al
tremendous support.
psicólogo porque
I
tuve
went to a
depresión.
psychologist because I was suffering
Nicolás
from depression, and
me
Nicolas
remitió
referred
al
me to the
psicólogo
psychologist
para yo poder,
so that I could
porque yo sentía que yo no podía
get some
tener
help.
este
I felt
papel
that I
como madre, que estaba
couldn't
haciendo las
act as a
cosas
mother.
mal,
I felt that I was doing things wrong.
no como yo ya
Not,
no quería volver a repetir la
I
misma
didn't want to
historia que había
repeat
hecho
the
con mi hija de
story
22
of what
años.
I did
Quería
with my
ser otra persona,
22-year-old.
quería
I
ser
wanted to be different.
mejor.
I wanted to be a better mother.
Gracias a que
And
vine acá
thanks to
al
my coming
hospital,
here to the
al
hospital,
CEPAL de
or I should say
Matasur,
to the
y
CEFAM in
me
Matasur,
escucharon, porque yo
where they
misma
heard
me
me,
ponía a
because
yo misma
I
fui la que quise venir y expresar lo que
questioned
yo
myself. I
sentía.
was the one who
Y yo
wanted to
siento
see whether
que
I
hay
could get
muchas
help. And I feel
madres
that
que
there are
se
many
quedan
mothers
calladas de
who
contar porque les
keep
da pena,
quiet
porque piensan que
because
las
they're
van a
ashamed, because
juzgar,
they think they're going to be
les da miedo
judged.
contar su
They're afraid
experiencia.
to tell their
Y yo
experience.
creo que no,
And
que uno
I
debe
don't think
decir
that's
lo que
right. I
uno
think that one
siente
should say what
y
one
que los que
feels,
trabajan acá
and that
están
those who
haciendo un
work
gran
here are doing a
trabajo, porque
tremendous
si no
job,
hubiera
because
sido así, yo no
were it
sé si en
not
este
for them,
momento
I don't
yo
know if
hubiera
I
vuelto a
would
cerrar
be,
la puerta y dejar a mi bebé
I
llorando.
would not be doing the same thing of closing my door and letting my child cry.
Entonces, en el taller de Nadie es Perfecto
In the
me
No
sentí
One is Perfect
escuchada,
workshop, I
aprendí
felt
las
that they heard me,
experiencias
they
de otras
listened to me. I
familias,
heard from the experience
creamos
of
realmente
other
con otras
families.
familias,
We
pero
supported
yo
each other with
siento
the other
que el que
families,
más me
and I feel that
escuchó
they
fue
listened to me, and the person who listened to me the most, listened to what I had to say, was Nicolás.
Y muchas gracias
Thank you so
por
much
escucharme.
for listening to me, for hearing my story.
Muchas gracias a
Thank
ustedes
you to
por
both of you
compartir la
for
experiencia.
sharing this
Estamos
experience with us.
muy agradecidos,
We're really very
señora Lady,
grateful, Mrs. Lady,
de poder conocer la experiencia que tuvo y
hearing your
también la
experience
participación de su
and
hija acá
hearing
en la
how,
presentación.
and hearing your
Quiero hacer
daughter
referencia
participating here as
también
well.
los
A
agradecimientos
special
al
greeting and
equipo de Chile
gratitude to
Crece, al
the
equipo
Chilean
del
team,
CESFAM de
Chile
Matasur.
Crece, Chile Grows, and the CEFAM
Creo que
of
Chile Crece
Matasur.
contigo
I believe
nos ha
that
mostrado la
Chile Grows
experiencia
with
del
you
enfoque integral
has shown us
del desarrollo
the
infantil
experience of
temprano.
comprehensive
Hay
development,
otros países
of
de la región
early
que lo están desarrollando.
development. There are other countries
Y
in
una
the
particularidad
in the
que
region who are
probablemente su
implementing this.
cobertura
And
nacional,
one of the
que fue,
interesting aspects of
digamos,
this
de
program
poco
is
en
the
forma
national
creciente, que
coverage.
actualmente
It's
incluye a
gone
todos
throughout
los
the country and
recién
includes
nacidos
now all
y
newborns
madres gestantes.
and
Y la
mothers,
naturaleza también
and
intersectorial, que creo que es
the
particularmente
intersectoral nature as
destacado.
well, which is, I think, is
El uso de un
particularly
sistema también de
important.
seguimiento
The use of
digitalizado
a digital
nos ayuda no
follow-up
solamente a
system
mejorar la
not only
eficiencia,
helps
sino
us improve
también
the efficiency,
permite
but
intervenciones oportunas.
helps us time,
Y creo que lo que han
act
mostrado
in
hoy
a
día
timely
puede
manner. And I
ser
think
muy
that what
bueno,
you've shown us
valioso
today
para
can
los países
serve
de la
as a
región. Así
valuable
que muchas gracias
model
por
for other countries
compartir
in the region. So
la
thank you very much
experiencia.
for sharing your experience with
Tenemos
us.
que seguir con
We have to
la
continue now
presentación
with the following
y en eso
presentation.
le
And
damos la
I'd like
bienvenida
to
a la
invite
doctora Dayani Machado,
Dr. Dayani
científica
Machado,
senior
who's a
de
senior
CIDAC
scientist in
Fiocruz, la
CIDAC
Escuela de Medicina
in
de Harvard.
Fiocruz and the
Ella
Harvard
va a presentar
School
el programa de transferencias monetarias
of
Bolsa
Medicine.
Familia
She's going
en
to
las
talk
tasas
to
de
us about the
suicidio en Brasil.
Bolsa Familia and the suicide rates in
Doctora
Brazil.
Machado, el
Dr.
micrófono.
Machado, you have the microphone.
Just a second. Can you see my presentation?
We can see
Yes?
it now. Thank
Yeah?
you.
Yeah.
Okay. Well, thank you everyone for taking the time to watch my presentation today. Thank you, Matthias. Thank you, Renato, for the invitation. It's a pleasure to be here speaking for you all. And today we'll focus on the impact of Bolsa Familia, which is the Brazilian cash transfer program on the suicide in Brazil. It's one of our main studies. And then I will start by saying that suicide, both suicide and mental disorders, they are multi-causal. And by that, I mean that many factors interact and influence them. For example, family instability, loneliness, unemployment, financial problems, genetic reliability, alienation at work, being a victim of violence, and this list goes on. But the problem is, although we know that there are so many factors that influence, we keep insisting in treating or addressing them in many contexts using the individual approach, mostly the psychological and the psychiatric approach. Not they are not important, but they're just not enough. And you might be asking why not using only this approach? And aren't all the cases they associated with them and actually not? And it also depends which context you are talking about. For example, this literature review done by Bertolot et al., he showed that 80 to 98% of all cases of suicide were thought to be affected by psychiatric disorder. But this proportion decreases to 58% when you go to the low-middle-income settings. And another systematic review showed that in low-income settings, 62% of all studies identified association between suicide and general poverty measures. But the next question would be,
Dr. Machado,
yeah.
so sorry to interrupt. It's just for many of the people in the audience. It's just to check the language and the interpretation. Para los que están escuchándonos en español y están preguntando por el idioma, pueden apretar el icono de interpretación, que es como un globo terráqueo que está abajo, en la barra de abajo, para poder elegir el idioma en que quieren escuchar la presentación. Gracias. Thank you, Dr. Machado. Sorry for the interruption.
Okay. Yo pido disculpas, pero mi español no es bueno, así que
I
no puedo
apologize, but my
tener
Spanish is really not good, so I
hablar
couldn't
español
possibly
porque
speak Spanish.
tengo que practicar más y
I will
la
have to
próxima voy
practice
a intentar
more,
hacerlo
and the
en
next time
español.
I'll try,
Por
but this
ahora,
time I'll have to speak in
mi
English.
inglés es menos peor.
My English is
No
less,
hay problema,
No
gracias,
perfecto
adelante.
tampoco.
not perfect, but
Va
less
muy bien.
bad.
Because my first language is Portuguese. So. Anyway, so the next question would be, okay, but then what we should do, what could then target this association between poverty and poorer mental health? So in 2004, Brazilian government launched the Bolsa Família program. And the Bolsa Família program is about transferring money to poor family or extremely poor family in the country under certain requirements, mainly focused on children that they must attend school. So for children, they must attend up to 85%, and the youth up to minimum 75%. For women, they have to attend the healthcare appointment, such as prenatal, and they have to follow all the vaccination schedules. And this program has been proved to have improved social inclusion, it has strengthened human capital among the poorest, it has decreased poverty and inequalities, and it has also increased the school attendance by young people and also decreased violence. And all these factors associated with mental health and suicide. There are several studies showing the major impact of this program on many health outcomes. And here we are trying to understand in the mental health. So we performed this first study where we found that municipalities in Brazil that had higher coverage of the cash transfer had lower suicide rates, up to 6% lower in the municipalities with the highest coverage. And the next question was, okay, but would it prevent also at the individual level? Would we see the impact of that individual, which means receiving or not receiving the cash transfer? To answer that, to address that, we put together a huge data set in Brazil. We took the whole hospitalization data in Brazil from the Ministry of Health, on the public system, which covers about 75% of the entire population in Brazil. And we linked that with the whole mortality data, and we linked with socioeconomic data and so on. By doing so, we were able to build a history of the Brazilian families. For example, we could hear if Maria joined the Cadastro Único, which is the platform where people register to apply for Bolsa Família and the other programs. So let's say Maria, she joined in 2001, and we follow her. And 2003, she was hospitalized by a suicide attempt, for example. And 2005, she got married to João. 2007, they had Pedro. And 2007, she was also hospitalized by a psychiatric disorder, a CV, psychiatric disorder. And in 2015, let's say João was killed. And 2015, she also ended up dying by suicide. So we are able to follow this family and understand what happened to them, and also check if they received or not the Bolsa Família. So in sum, if you think like the Brazilian population back in time when we had the first cohort built, had 2,011 million people, over 50% of these people were registered at the Cadastro Único, which is the data set, the main one we are using. And then by that, we checked who received the Bolsa Família, who did not, and then checked who died by suicide and who did not in both groups. And all of that in a long period of time. And by doing so, we are able to find out if receiving the cash transfer was associated with reduced suicide, and we found a 56% lower suicide rate among those who were Bolsa Família beneficiaries compared to those who were not. And this association was stronger among women and also among people 25 to 59 years old. So what these programs here are doing is basically targeting the basic needs. So if you check with me, the first pyramid that I'm showing is the Maslow hierarchy of needs. Maslow, he proposes that we have the physiological needs, like food, water, warmth, and then safety needs like security, safety, etc. And those are our basic needs. And once they are matched, and then we move on to the next level. There are more updated theories. This is a bit outdated, but my point here is saying that what these programs are doing is guaranteeing to this family the basic, the water, the food, what they could not have in many cases if this program did not exist. So moving to the second pyramid, the framework for public health action proposed by Thomas Frieden. He says that while if we impact at the socioeconomic factors, we increase the population impact. While we move to the next levels, so he proposed socioeconomic factors, bottom up, socioeconomic factors, and then change the context to make individuals default decisions, healthy. And then long-lasting protective intervention, then clinical intervention, and counseling, and education. So if we intervene more at the bottom, which is the socioeconomic, we increase the population impact. We spread to more people. And when we move to the top of the pyramid, it increases the individual effort needed. And inspired by that, the WHO also, the third pyramid here, WHO also proposed the optical mix of services, where they added the information on the castes. As more you move to the top of the pyramid, higher is the castes for the health services. We know that long stay facilities are the most pricey ones. And if we impact at the bottom, then we could prevent from people to get severe and they need more specialized care. So those programs, they have been spreading and growing all over the world, but it's just not enough. And I think we should aim for more. And we should aim for more because the number of people experiencing hunger has been increasing since 2015. And we saw an acceleration in 2012 due to the pandemic and also conflicts that we are still seeing around the world. Most people with mental disorders, this is not only the Americas, but in the entire world, are not having the need matched. They are not accessing assistance, they're not having access to assistance. So if we compare, for example, high-income countries, only 23% of people with depression actually get assisted by that, get specialized care. And only 3% or any type of care. And only 3% in low middle-income countries. So there is still a huge gap in the Americas and the entire world. And most mental health services are also overwhelmed, as we know in our region, it's very overwhelmed too. And up to now, no other intervention has shown such a strong effect on suicide. So I would like to conclude with 3 final messages. And the first one is that ending poverty would then likely alleviate the strain, we would expect that, on scarce resources for mental health treatment. These programs has the potential of impact on people, impact on services, and it could decrease the costs for the health system. And they also could result in a lower rate of suicide and also psychiatric hospitalization. So we have a paper to be published where we show a decreased hospitalization by alcohol consumption, but because of time limit, I just brought it suicide specifically. And these interventions, we would guess that these interventions will be even more needed in the future, but is already needed now for several reasons, such as the advancement of technology, my English is not great either, automation of many jobs, which means the jobs are being taken people are being substituted by machines are taking the jobs. Not that the technology is all bad, but there is this effect that we're gonna have to deal with in somehow. And additionally, facts such as conflicts, disasters, and like the ones resulted by climate change and disease outbreaks. And all of that will increase the need for this type of programs. And I would finalize by saying the modern era, intersectoral approach, as Renato commented about at the beginning of this webinar. And I would say that including financial protection in this intersectoral approach, it will be imperative to enhance global mental health and prevent suicide. So thank you.
Thank you so much for your excellent presentation, Dr. Diana Borges Machado. Creemos que lo que se ha presentado, el programa Bolsa
We
Familia en
believe that
Brasil,
what you
nos
showed
da
about
evidencia
the Bolsa
convincente del vínculo
Familia
entre lo
program
que
in
puede ser
Brazil
la protección
shows the
social
link
y la
between
salud
social
mental,
protection and mental
y que
health.
esta reducción que se
And
observó en la tasa de
this
suicidio,
reduction, the drop that
especialmente
we
entre
found in
mujeres
suicide rates,
jóvenes, subraya la
particularly amongst
importancia
young
de
women,
poder abordar los
underscores
determinantes
the
sociales en
importance
salud
of
mental.
dealing with
Y este
social
estudio nos
determinants in
parece que
mental
fortalece el
health. And we
argumento
believe that
a
the
favor
study
del enfoque que sean
heightens the
intersectoriales en la
argument
prevención
in
del
favor of
suicidio y en
having
la salud mental
intersectoral
en general.
approaches in mental
Será
health
muy importante
and
conocer
suicide
más a
prevention. It
fondo
will
los
be
mecanismos
important to
específicos
learn what the
que
specific
están
mechanisms
más
are,
abajo, ¿cierto? De
to learn
cómo
about the
estos
details of
programas
these
impactan
mechanisms
la
and
salud
how the
mental.
programs have an impact
Agradecemos
on mental
nuevamente a la
health.
doctora Borges
Once
Machado
again, I would like to thank
y damos
Dr.
ahora
Borges Machado. And now we'd like
el micrófono,
to
¿cierto? A
move on
Mrs.
and
Ingrid
give the floor
Bonilla,
to
who is a nurse specialist and psychiatric nurse practitioner. She's going to present today about mental health prevention in Belize, the Belize perspective. Please, Nurse Bonilla, the floor is yours.
Thank you.
Are you going to
All
share
right.
your screen, or do you prefer us to share the screen?
Well,
I think
it's
that
not been.
you share it.
Let me share it. Then I
Okay.
thought it would.
Yeah, please
Just
let
give
me
me a
know.
minute.
He can help if
Just give
needed.
me a minute. I'll share it right now. Got it there?
Not yet.
Not
If you
yet?
prefer not,
Not yet.
no.
Hold on. Okay.
Okay. Now we see your screen and the presentation. Thank you.
All right. Thank you. So yes, my name is Ingrid Bonilla. I work with the Ministry of Health and Wellness here in Belize, and I'm a nurse specialist, functioning under the psychiatric nursing program. So to give you an idea of our health services here, when it comes to mental health, there was a time back in history when, for the need of mental health services, that nurses were sent to within the community as a form of almost a punishment. So that was the area that you would be attached to if you needed to provide mental health services. Over the years, of course, with education, people have now been able to embrace what mental health is about, especially the Ministry of Health and Wellness, who does its best to ensure that we provide that service to our community. And so eventually in the 1990s, there were nurses that were trained in order to provide psychiatric care to the community. And so this is how within our communities we were able to now provide this service, to include treatment, to include education, allowing for consumer activity. And as time went on, more nurses were trained apart from the 1990s. So within that time frame, we've now had 3 trainings of nurses that are site nurses now. We also have that we have a long-term stay facility that's within our capital city at present. Within that facility, we don't have people who actually come and go. We do have clients that were from the original hospital setting. And so they are at this long-term facility. And for acute care services, we do have the hospital services that are available within each district hospital. So there was a relocation of our main hospital that was closed down, and that was relocated within the capital city. For our acute services, as I mentioned, we do provide that within all our hospital settings. And for our community outreach, we have what we call a community treatment program. This community treatment program now allows for us to go into homes, and for clients who would not come to the hospital setting or the clinic setting, we then go to them. This is only to ensure that we avoid a relapse and, of course, for continuity of care. So this leads us to where our presentation for today would mainly focus on, which is our outreach and collaboration with agencies, because we ensure that based on our mission, we do provide that treatment within our communities. So we have 6 districts, and based on these 6 districts, we also have mental health services in all these areas. So the mental health program of Belize has actually stood on the principle of ensuring that we focus on collaborating with various stakeholders, and PAHO, of course, being one of our stakeholders. We always get support from them. And so the government of Belize, along with PAHO, embarked on an initiative where we were focusing on the road safety project. So in its second phase of this road safety project, the aim was to ensure that we supported those persons who were involved in road traffic incidents with ensuring that they got emotional care. And the interesting thing about this is that this is a first of its kind, where psychological first aid is introduced as well and tied in with actual road safety. So I found that to be very interesting. And so, of course, I was a part of doing this initiative as well, representing the Ministry of Health. And it included changing how others perceived road crashes. You know, usually you would find that individuals may be blamed for an incident. So the focus was not to go in and say who's at fault, but the focus was to ensure that I am here for you. Do you need help? And so this is our initiative in ensuring that we provided that support. So within the 6 districts, we're also divided into 4 regions. And so with the road safety project, it encompassed having individuals from all the districts, because it was a training of trainers. So with the training of trainers, we had to ensure that others also passed down this information. So it included the traffic department, the police department, Ministry of Health and Wellness, of course, and it included the National Drug Abuse Council and various other organizations that took part in this training. After the training, we ensured that the other personnel were trained from other departments as well, to include the very departments that attended the training. In order to have done this, of course, there had to be a format. The trainers were provided with booklets in order to ensure that we were all doing the same thing, not necessarily that we changed anything, because we wanted to ensure that whatever we passed on, everyone was grasping the understanding that it's about emotional support for others who are involved in a road traffic incident. And if you notice, I keep saying incident because we were also changing the narrative in ensuring that it was not being said an accident. Accident makes it seem as if though, okay, you're at fault. But an incident shows where there can be error across various aspects. And it's not necessarily about blaming. So topics included how to prepare to deliver the training. And this was very important because, you know, sometimes people may think that they know how to provide a training, but with that collaborative effort, we all were on one stance of how to go about delivering this training. And it included how to, the introduction to road safety and exactly what was psychological first aid and how to tie it in together with the road safety incident. Of course, taking care of yourself. This is always important. How to take care of yourself and your colleagues. And of course, the manual also guided us on what materials we may need in order to ensure that the trainers would have something in order to refer to. And
That's what
they,
Ms. Bonilla, we have 5 minutes left.
okay. The promotion and prevention activity, of course, this is ongoing. To this date, we have since done the training, trained others. We have had advertisements on television that keeps playing within the community, on the local stations, on the radio, within the clinic settings. When you enter, you would have the commercials being played in order to remind others that there is support out there. Posters, of course, were developed, and whenever we have outreach activities, these posters are shared with schools and within the community. The posters included having the self-assessment test. These are the posters. It included your self-assessment test after an incident. You can ask yourself these questions. So this is a guide for those who might have been in an incident and wanted to know if they were doing okay. Because we want to pick up if persons are anxious, if they're depressed, if there is some trauma they're going through. And of course, where to seek the services. There is also the QR code in order for others to know, okay, if I need to get help, where can I go? And in conclusion, we want to be able to ensure that we take care of our Belizean community. So the plan, of course, is to continue taking care of our community when it comes to road safety incidents. We want to continue promoting the services that we, under the Ministry of Health, offer through the mental health program. And of course, continue to create that awareness, always ensuring that we do outreach activities, whether it be to schools, within fair settings, anywhere within the community where we can reach others. The key is to work together in order to take care of ourselves so that we in turn can also look out for others and their well-being. And also, we must make a stance for mental health. So this is the key thing in order for us to promote and prevent mental health conditions within the context of our country of belief. And so, thank you.
Thank you, Nurse Bonilla, for your excellent presentation. I think that we have a lot of lessons from the initiative that you show. I'm going to switch to Spanish. Creo que la iniciativa de Belice
It
nos
seems to
ofrece
me
un
that this
ejemplo que es
initiative
inspirador
about
de cómo
Belize
integrar la salud
shows an
mental
inspiring
en áreas que no
source
son
in order
necesariamente
to
salud,
bring
en
in
este
mental
caso la
health in
seguridad
areas that
vial,
are not necessarily
y en
health.
ese
In
sentido
this
la
case,
incorporación de
traffic
primeros auxilios
incidents and
psicológicos
highway
en la respuesta
incidents,
a accidentes de
and therefore
tránsito es
psychological
verdaderamente
support in the
innovadora.
response to
Este
traffic
enfoque
incidents is
no
quite
solo demuestra la
innovative.
importancia de la
And this not
colaboración
only shows that
multisectorial,
the
sino que
importance of
también nos muestra
multisectoral
que en
cooperation,
contextos de
but it
recursos
also
limitados
shows that
pueden implementarse
in
soluciones creativas y
situations of
efectivas.
limited
Va a ser muy
resources, we can resort
importante seguir de
to
cerca esta
creative
iniciativa
solutions.
para
So
ir
we will
evaluando su
follow
impacto
closely this
y para
initiative in order
poder ser
to assess
aplicada en
its
otros
impact
contextos.
and to see whether it can be
Agradecemos
enforced and used in
mucho a los
different contexts.
presentadores,
We
son
want to
excelentes
thank the
presentaciones. Creo
speakers.
que
We've had
hay
excellent
muchas ideas
presentations this
y
morning.
mucha
There are
inspiración
many
en lo que
ideas
están
and a lot
haciendo.
of inspiration in what you're
Y
doing.
tenemos un
And
espacio entonces
we
de
have
preguntas
some
y
time now
respuestas como
for
para poder
Q&A so that
discutir y
we
hacer
can
una
discuss
conversación dentro de las
and
limitaciones que
establish a
tenemos
conversation
en
within
este tipo de webinarios,
the
pero
limits that we have in
profundizar un
these
poquito más
webinars,
con
but
los
to delve
expositores.
deeper with
Entonces,
the speakers.
les
So
pido a los expositores que
I'd like
puedan
to ask
abrir sus
the
cámaras
speakers
y
to
estar en
please
esta sección de preguntas y
turn their
respuestas.
cameras on so they can
Tenemos
participate in this
algunas que
Q&A
hemos
session.
recopilado.
We have some
Gracias,
that
Luz
we've
Marina,
collected. Thank you,
por
Luz
todo el
Marina,
trabajo y por
for all the hard
sintetizar
work.
las preguntas. Tenemos algunas preguntas al equipo de Chile
And
Crece
for
Contigo.
summarizing the
Y
questions,
una de
we
ellas
have a
es,
couple of questions
¿cuál
for
fue el
Chile.
principal cambio
What was the
que
main
pudieron
change
ver en la
that you were able
crianza
to see
de su hija
in the
específicamente?
rearing
Y
of
en ese
your daughter
sentido, ¿qué
specifically?
es lo que notan que es diferente comparado
And what do
con
you think is
la
different
crianza que tuvo
compared
de la hija
to
anterior que
the raising of your
no
previous
estaba,
daughter
¿cierto? En el programa Chile Crece Contigo.
that did not participate in this Chilean
¿Alcanzaron a
program?
escuchar la pregunta?
Were you able to hear the
Sí,
question?
ya. Yo
Yes.
creo que lo que sentó
It
a mí
seems to
fue
me
cuando yo
that
vine al
what was
programa.
different is that when I came to the program,
Cuando yo vine al taller,
when I came to the
resulta que
workshop,
estábamos hablando y
it
llegó el
turns out
tema que
that
a los
we were
niños
discussing
los
and talking
bañaban
about
para que se
something that
calmaran.
was being done. Children were being
Entonces
bathed
llegó el tema
so
que
that they would
yo
calm down.
encerré a Antonelita,
So
cerré la puerta y la dejé
I
llorando.
closed the
Y a
door
mí me
and I
dio
left
golpes
my
en el
daughter
corazón. Y eso fue lo que
closed
hizo que yo
behind the door
expresara
and
lo
she
que yo
started
sentía.
crying. And that is why
Tal
that
vez
broke my heart and
si
I
yo no
expressed what
vengo
I
al
was feeling.
programa
Maybe
que
if I didn't
hizo
come to the workshop,
Nicolás,
to
que
the
hizo el
program
Cefam
organized
Matasur,
by
yo creo que
Nicolás and
no fuera
Cesfam
la mamá que
Matasur,
soy ahora.
I wouldn't be
La
the mother
crianza
that
que
I
yo
am
le di a
now.
mi hija mayor
The
no fue una
rearing
crianza,
that
yo
I
creo
gave
que
my
adecuada.
older
¿Por qué?
daughter
Porque
was
yo no
not adequate,
tuve,
according
en
to the way
Colombia
I
nunca
see
me
it,
dijeron
because in
vaya a un
Colombia I was
curso,
never told
vaya
go
cómo
to a
debe
course
enseñarle a
and
amamantar
go
a su
learn how
hija.
you need to
Aquí
breastfeed your
desde
daughter.
que
So
yo
here, ever
vine al
since
control,
I came
ya
to
yo
control,
me enseñaron a
I
darle
was
teta a la
taught
niña. Cuando
to
de pronto
breastfeed
yo
my
también pensé
girl.
que estaba haciendo mal,
And
vine
when
allá a
I
la
thought that I
nutricionista
was
y
doing something
también
wrong,
me
I came to
atendió.
see the
Nos dieron
nutritionist, and
el
she
cojín, un
also
cojín así,
looked
que uno
after
se
me.
ponía
They
aquí
gave
y se
me a
dejaba el bebé
pillow,
para amamantar.
something
Eso
that
lo
I
aprendí
had to wear
gracias
around my waist so
a
that I
que
could
la
rest my
nutricionista
baby. And I learned that
me dieron
thanks
una
to the
cita,
fact
o
that
sea,
the
no tuve que
nutritionist
rogar
gave me
para
an
que me
appointment. I didn't
vieran
have
con
to
una
donate any
urgencia.
money so that I would be
Entonces lo que
seen
a mí
with a
me
baby.
golpeó fue como
So
yo
what
creo que más
struck
que
me
todo eso,
more than
que
anything is
aquí
this,
me
that
abrieron las
here they
puertas,
opened
me
the doors,
escucharon.
they heard me.
Me remitieron también
And they also
al del
referred me
psicólogo
to the
porque
psychologist
tuve
because I was very depressed. I was walking down the street. I saw Nicolas and I started blurting out what I was feeling. He didn't know who I was, if I was Colombian or Venezuelan. He simply listened to what I was saying. And I believe that this is what really marked me. I will always be grateful to Nicolas. I will thank him for having appeared in my life to hear me, because I don't know whether I would exist and whether my baby will exist, because it was horrible. I tried to overcome this because I've already done that, but I'm eternally grateful when they received my daughter. This is something that I don't know how to describe. I feel like crying and I apologize. And what changes do I feel? Well, I've improved as a mother. I don't scold her and I don't leave her there to cry their heart out. I want her to express what she feels. There's no need for beating the children. There's no need for mistreating or abusing the children. You should calm down and let them be children. So it is a process. I have some books that we were given during the workshop. We were given 5 books where it tells us how to raise your children, how you should behave at a moment where they throw a temper tantrum, when they cry, etc. Thank you very much, Lady Spina, for sharing that experience. It is moving for all of us, particularly when we speak about raising our children. We speak of something that is very close to us, very personal and very necessary. It is obvious to see that we need support when going through such a critical stage. Thank you for sharing that experience. We have some questions about Chile Crece in general, and one of the questions is if this is a program or a subset of programs that take care of the entire population or only migrant population. And it seems to me that I can quickly respond to that, saying that it is of national coverage. So in that regard, this is a program that has been implemented throughout the country for all mothers and their boys and girls, understanding that it not only covers parents. There are also some specific aspects that have to do for men, parents, fathers, because they might need some support for the raising of their children. Now, let me move on to other speakers. And I'd like to ask Dr. Martin Machado. We have a question.
And the question if the Bolsa Familia program only includes families and not individuals for financial reasons, to contain costs, or for political reasons. Single individuals are expected to help themselves, or for any other reasons. And if the studies on the program impact on suicide compared the impact for individuals who are part of the families versus individuals in similar socioeconomic circumstances who are not eligible for the program. Sorry, it's a long question, but I don't know if you can share with us some of the answers or comments about this question.
The program is not only for familias. If you are single, you also can receive. They decide who is going to receive or not, depend of the income, because the program is targeting the poorer people in Brazil or the extremely poor people in Brazil. So it depends on what is the income per capita. So let's say a family of 3, they divide the total income per 3, and then depends on how much is you will receive or not. And if you're a single person, you still can receive, although there are some extra money that you can receive if you have a child or pregnant women. And regarding about those not eligible, yes, we compare those who received with those that did not receive because they're not eligible. We have in our data set all the half poorer of the Brazilian population. The data that we don't have are among those that are richer, higher class. We don't have this data. Although we know that the impact are much stronger among the poorer people. The impact of poverty is going to be strong. We're going to only be able to measure the impact in poor people. we wouldn't be able to measure in rich people anyway. I don't know if I answer all.
Yeah, I think it covered it all. Thank you for your answer. And we have also a question for Nurse Bonilla. And I think it can be a question for other programs. If you can provide, if regardless of the profession, can you provide psychological support considering that training can be provided? So the question is mainly, who can provide psychological support? Nurse Bonilla.
Yes, thank you. Anyone can provide psychological support. It's not for experts only. It's for anyone that comes across someone who has had some type of experience when it relates to some incident, whether it be, in this case, yes, we did road safety, but it's also applied to other types of disasters. So it's for anyone who comes across someone that has been in some type of incident. So it's not for experts, it's for anyone.
Thank you. That's clarifying, because I think it's important to know that we don't have professionals, mental health professionals in all the region with all the needs that there are. So we need some task shifting and training of psychological efforts. It can be done to almost anyone. Great. Podemos volver al equipo de Chile Crece. Hay muchas felicitaciones para el programa.
We go back to Chile and the Grow With You or Crece Contigo. Congratulations for the program. I wonder if there's a question that maybe Ms. Lady can answer us with regard to the structure of the program, the resources offered to the families. How are these financed, and what professionals are in the teams participating in Chile? Well, the system of Grow With You in Chile is the psychosocial and family services, and we implement the 3 health programs. The financing includes a reinforcement of the multidisciplinary primary care services, and Chile Crece has 2 large programs, but it also includes the assistance to the newborn, which are the tools given to them, and the educational actions during maternity. So there's reinforcement. Primary care in Chile and the multidisciplinary team is divided in sectors. A sector and a team does the follow-up of the families and the children from gestation to adult, and completely as long as they're in the area. So the same team follows the family, the neighbors, the community in a longitudinal manner, as physicians and nurses or social workers, psychologists, midwives, dentists, occupational health, toddlers, school children. So we include all the components. The financing is addressed to reinforce the midwives programs or the nursing programs or the school children's education or what have you. So we have a structure which is probably clearer when we divide by regions, but we also have health services, like we have the Ministry of Health, then the health services, and then the primary care, for where the resources are for the municipality. So we have resources for the health services, and usually there's support with technical support, training, support of the teams, and financing, most of which is for primary care, mainly at a municipality level, for the hiring and for home visits, for example, where we need a lot of mobilization, or maybe during certain specific situations where they've needed technology to connect with the families, for example, or maybe replacement of input or materials that are used in the simulation rooms, in the rooms where the children having some risk or delay are cared for. or the children who may have biopsychosocial problems too. Thank you. I think that was very clear. And we also want to leave you with some links of the program so that you can go in and check to see the services they offer, because we have to recognize that they offer many activities and many different things which complement each other, and I think it would be important to review them together. Thank you.
Now we have a couple of questions more for Dr. Diana Machado. I think, Dr. Machado, that your presentation got a lot of attention. And one of the things that, or the comments that we have is, what do you think about how to be more efficient in terms of doing this type of intervention? Should these programs be conditional or unconditional?
So this is an ongoing discussion, and there are some people those that defend that it should be unconditional. They argue that by putting conditionality, we will treat people as a child, and we should empower those people. You should trust they will do the best use of the money. And but I would say that it depends on the context, because in the case of Brazil, for example, we had lots of kids on the streets. And because of the requirement of taking these kids out of the street and send them to school and keep them at school attended up to minimum 75–85% of attendance, it solved another problem that was the kids on the streets. So if you put this requirement in a country, a Scandinavian country, for example, it may not even make sense because all the kids are going to school. But in the case of Brazil, it was necessary, and we can't wait until the next generation or this generation realize that it's very important taking the kids to the school. So I would say that it depends actually on the context.
Thank you for your comments. I think it's very, very wise comment. That I completely agree that it may depend on the country and on different aspects. So thank you for your answer. And the last question that we have for Nurse Bonilla is, what are the next steps that do you think that Belize will be embarked upon in reference to this project or other projects related to prevention and promotion in mental health? Thank you.
Yes, thank you. In relation to this project, we still have more trainings to get done. So we still have more people that we have to do this training with as well. So that will be continuous. And then with other projects, yes, we're hoping to embark on anything else that is in relation to outreach activities. It's one of our main focus when it comes to the mental health service. We try to ensure that we keep on passing the message and the word. So anything that can help promote activities that can involve others is what we hope to always continuously be doing.
Thank you, Nurse Bonilla. Hay otras preguntas que son muy interesantes.
We have other very interesting questions.
Déjenme ver, estamos
Let
tratando de
me
seleccionar
see.
para poder
I'm trying to
revisar.
select
Tenemos
them
solo
because
algunos minutos más.
we only have a few minutes left.
Nurse Bonilla, probably extending
Enfermera?
your answer. There's a question also. What has been the challenges, the most important challenges to implement these programs in Belize in terms of seguridad vial, security?
The challenges, although we have mental health being embraced, the challenge still remains as it relates to stigma. There is still that aspect of stigma that, still follows and trails behind activities and things that you might want to accomplish. And when I say stigma, it's not necessarily just from the public setting, but it even sometimes includes within your own health setting, where in some instances, the acceptance is still not as you may think it should be. So I believe that in trying to target the stigma that still holds us back a little, that's where we have to really work the hardest.
That's a very good point, and thank you so much for pointing it out, because I think that we need more stigma reduction interventions in Latin America and the region. Thank you. Y ahora vamos con las últimas preguntas.
And now the
La
last
pregunta para el
question,
equipo de Chile que se
one for the Chilean team,
es,
grow with you.
sé que hay alguna estadística o
Are
algún
there any
trabajo
statistics or any
que
work
pueda mostrar
that
el
can
impacto que tiene el
show the
programa Chile
impact
Crece
of
en
the
salud
program
mental,
of Chile Grows in mental health,
específicamente al ofrecer
specifically
educación emocional a los
offering
niños
emotional
o
education to the
soporte a
children
las familias?
or support to the families?
No, no tenemos un
No,
estudio
we really don't
todavía
have any
publicado
studies
respecto a
yet
salud mental.
published
Solo
on
contamos
mental
lo
health.
más vinculado
We
al
only
estudio que se
have
hizo
the
de
study that
impacto
was
con el Banco
done on
Mundial
the impact with the
respecto
World Bank
al efecto también en la
regarding
crianza de
the
los niños
effect
y
in
en el
the
bienestar
child
que ellos
rearing
tenían,
and their
porque la familia en
welfare
su conjunto 3 años posterior
3 years
a haber
after.
vivenciado el taller Nadie es Perfecto, que son 6 sesiones
That's
con un
6
grupo
sessions
cerrado.
with a closed group.
Y eso es lo más cercano a evaluación de
That's the
impacto. Nosotros
closest we
tenemos
have of
evaluaciones
impact evaluations.
cuando
The other
se cumplieron
evaluations
los 10
are
años
when we reach the
de
10
Chile
years
Crece Contigo,
anniversary of the
también
program.
hay una
We
evaluación
also did
respecto a
an
la
evaluation
implementación
of
del
the
subsistema. Ese
implementation of
también
the subsystem,
está publicado.
which
Los
is
otros
also
son estudios
published.
que se van
The others
realizando
are just
por
studies
ambos
that are done
ministerios
by
respecto a
the
la
two ministries
implementación de
regarding
algunos
the
componentes y de
implementation of
algunas
some of the
estrategias en
components and
particular.
some of the strategies.
Muchas gracias. Creo que puede ser muy
Thank you
útil para
very
la
much. I
audiencia
think that is
conocer
very
esos estudios.
useful for
Nosotros
the
podemos
public to know these
compartir
studies.
para
We could
poder
share
ver
them
efectivamente el impacto
so
que ha
that we could
creado
actually see the
algunos de los programas
impact
o acciones de Chile que se
of some of the
y la
programs and
importancia,
actions of
¿cierto?,
this
de hacer
program,
esos estudios
Chile Grows With
de
You, and
impacto y
the
de
importance of
efectividad.
doing the impact
Bien,
and
and the last
effectiveness
question that
studies.
we have for Dr. Machado, Jorge Machado, is if the program Bolsa Familia check any trauma of childhood before and after the implementation of the program. If it is, if it will be able, the program, to be available to another international financial support. That's one of the questions that we have.
Sorry, let me confirm if I understood right. If it checks some trauma, you mean like PTSD?
Yeah, that's a question probably related with other factors that may be important. The question includes trauma, childhood trauma, or probably ACE, but it could be other factors that are important to incorporate in the evaluation.
Yeah, I think trauma is a very important thing that should be evaluated. But in our case, we use data from the government, and we don't have a large data set or even a data set public available for trauma. We do have data about hospitalization, so we investigate the hospitalization, psychiatric hospitalization, and as I mentioned before, we evaluate the alcohol psychiatric hospitalization by alcohol consumption. So, and we are seeing a decrease in the risk of hospitalization once the person received the program. We also evaluate violence, not the trauma specifically, but some outcomes in violence, and we also see some impact on that. And the second question was referring to the funding. So in Brazil, we are using Brazilian governmental funding. So the Brazilian government made the Bolsa Familia a unified system. They implement the Bolsa Familia inside this system that provides this program for the entire country. And with it is exactly because of this system that we have this huge data set that we can use. There are many other several programs around the world, including in South America. Chile also has a program. and in the Americas as well, Mexico, actually, they started before Brazil. But I'm not aware of an international fund that could help other countries. And I think this is a very important point, and I think we should think about it, consider that it in the future, especially because many countries will not be able financially to support a program that requires so much money, but also has a very high impact on mental health and also other types of physical health outcomes.
Thank you so much. Muchas gracias a nuestros distinguidos panelistas, al
Thank
equipo
you
de Chile
very
Crece
much
Contigo,
to our
Lady,
panelists,
Verónica,
the team in
Dayana,
Chile,
Dr.
Lady,
Machado,
Veronica,
Ingrid,
Dayana,
Renato,
Dr. Mayano,
Dr. Bonilla,
Ingrid,
everyone for
Nurse
your
Bonilla,
important
everyone
contributions,
for
of today.
these
Hemos
important
explorado varios
contributions.
aspectos críticos de la promoción y prevención de la salud mental
We've looked
en las
into
Américas,
prevention and promotion of
y
mental
quiero
health in the
solamente
Americas,
cerrar
and I simply
con
wanted to
algunas
bring
ideas
this to an
que
end
me parece que
with
son
some
importantes.
ideas that I
Creo que
believe are important.
los programas que se han
The
presentado hoy día
programs
muestran
that
un
have been
panorama que es
presented
inspirador
nowadays
de
show
esfuerzos que
a
son
situation that
innovadores
is
que se
a
están
great
realizando en la
source of
región,
inspiration,
que pueden promover
innovative
la salud
programs that
mental
are being
y
carried out
prevenir
in the region to
trastornos de salud
promote
mental.
mental health
Desde el enfoque
and
integral del
prevent
desarrollo
mental health
infantil de Chile Crece
disorders.
Contigo, pasando por
Children's
el impacto de los
development in
programas de
Chile, going
protección
through the
social en
impact of
Brasil,
social
hacia la
protection programs in
integración
Brazil,
creativa de la salud
the
mental en la
creative
seguridad
integration
vial
of
en
mental
Belice.
health
Hemos visto
in
ejemplos
traffic
concretos de
safety
cómo
in
podemos
Belize. We've
abordar la salud
seen
mental de
concrete
manera
examples of how
multisectorial
to
y en
deal with
forma
mental health in a
multinivel.
multisectoral way
Creo
and
que estos
in
casos
multiple
nos han dejado
levels.
algunas lecciones
These cases have
importantes, la
led behind some
importancia de la
important
intervención
lessons of
temprana
the
y
importance
el
of
apoyo
early
continuo a lo
intervention and
largo del ciclo de
continuous
vida, y no
support
esperar
throughout
el
this
tratamiento de los
service,
trastornos,
and
sino
not
que más
to
bien
wait for
enfocarnos
the
en
treatment of
promoción
disorders,
y
but to
prevención
concentrate on
temprana. El poder de
promotion and
los
early
enfoques
prevention.
intersectoriales y
The
la
power of
colaboración
intersectoral
multidisciplinaria
approaches and
que sin duda
multidisciplinary cooperation
amplifican el
no
efecto de las
doubt
intervenciones,
enhance
el
the
impacto
impact
de
of
políticas
interventions,
sociales
the
que pueden
impact of
tener en
social
salud
policies
mental y que
that
fueron
they
mostrados
might
hoy,
have on
además de la
mental health and
necesidad de
that were
innovar y
mentioned and
adaptar
shown
nuestras
today,
estrategias a los
besides
contextos
adapting our
específicos de cada
strategies to
país
specific
y
contexts in
provincia
each
de la región.
countries and
Mirando hacia el
provinces in
futuro,
the
creo
region.
que tenemos algunos
With our eyes in the
desafíos de
future, we
fortalecer
have some
los sistemas de
challenges in
salud para
strengthening and
integrar
beefing up
mejor la promoción
health
y prevención de la
systems
salud
in order
mental,
to deal better
invertir
with the
más en
prevention and
investigación para
promotion of mental
comprender
health,
cómo los
to
determinantes
invest
sociales
more in
pueden
research
impactar
to see how
nuestras
social determinants
intervenciones,
can have an impact on
fomentar
our
sin duda
interventions,
colaboración entre sectores y
to talk
disciplinas
about cooperation
y
between
promover
sectors and
políticas
disciplines, and to
públicas que
promote the
reconozcan y
public
aborden
policies
los
that
vínculos entre el
acknowledge
bienestar social
and deal
y
with
la
the
salud
links
mental.
between
Desde
the social
OPS,
well-being and
OMS,
mental
vamos a
health.
seguir
From
apoyando a los
PAHO,
países
WHO,
miembros en
we will
nuestros
continue
esfuerzos,
supporting our
facilitando
member
el
countries in this effort,
intercambio de
facilitating
conocimientos y
the
mejores
exchange of
prácticas
knowledge
y
and
abogando
best
por políticas que
practices,
prioricen la salud
and
mental
fighting
como un
for
componente
policies that include
esencial del
mental
bienestar
health as an
global.
essential component of
Les
general
animo a que
well-being.
cada uno de ustedes tuvimos
We encourage
una
you so that each one
muy
of
buena
you
audiencia, más de 500
will
personas.
participate. We
Lleven
had more
estas
than
ideas a sus
500
respectivos campos de
people
trabajo, que
today, and
sigan
we hope
innovando y
that you will
colaborando,
bring
que
this to
mantengamos
the
la salud
different
mental
fields of
en
work
el
in which you
centro de nuestros
operate,
esfuerzos
and
para
that we
mejorar la
continue
salud pública
fighting,
en las
keeping
Américas.
mental health at the very
Agradezco
core of
mucho a nuestros
improving
distinguidos
health in
ponentes,
the
a todos los
Americas. I thank
participantes
all
por
the
su
speakers
atención
and
y
all
compromiso,
participants for their
especialmente al equipo
attention and
técnico
their commitment,
también,
the technical
Luz
team as
Marina,
well, Luz
Natalia,
Marina,
el equipo de
Natalia, and
comunicaciones,
the communications
por
team.
haber hecho
I
posible este
thank you
webinar.
all for
Continuaremos
making
trabajando
possible this
juntos
webinar.
por
We
una
will
región
continue to work
donde la salud
together
mental sea
for a
una
region
prioridad,
where mental
una
health
realidad
will
para
be a
todos.
priority and a
Muchas
reality
gracias
for
y
all.
que
Thank you
tengan
very
un
much,
excelente día.
and may you have an excellent rest of the day.
Hasta luego. Gracias. Hasta
Gracias.
luego.
Y saludos a tu hija.
Thank you. Thank you, everyone.
Gracias a todos.